Now we're going to talk about some of the conditions that happen during pregnancy that can either be impacted by or caused by nutrition. So the first one that we're going to start with is morning sickness. And I think anyone who's ever experienced morning sickness recognizes that it has a really bad name. It does not just happen in the morning, was obviously named by somebody who never actually suffered from the condition. But morning sickness can range from periodic nausea for some women to obviously things that can be more serious where women are vomiting a lot. If you are experiencing nausea, there are some things that you can do to try to help. So one of the things is making sure that you don't get too hungry, making sure that your blood sugar doesn't get too low. This means packing snacks with you wherever you go, making sure that you have snacks at the office, making sure perhaps that you're putting something like crackers or nuts beside your bed in the morning so that you can eat a little bit before you stand up. It can also help to make sure you're taking your prenatal and any other supplements with food. Sometimes taking them on an empty stomach makes the nausea worse. When you are feeling particularly nauseous, it's always a good idea to have quick and convenient nutrition on hand. So whether it's leftovers that you can reheat quickly or whether it's doing something like a smoothie for liquid nutrition, making sure that you can still get the nutrition that you need when you're feeling nauseous is really important. Food odors are another thing that can make nausea worse. So where possible, perhaps we can ask our partner to cook for us, or making sure that we're cooking in a well-ventilated area, or maybe we're barbecuing outside versus cooking inside. Even doing things like using canned fish in order to get our DHA and our omega-3 intake versus cooking fish can just make the process a little bit more appealing. Obviously, if nausea and or vomiting get really bad and it's becoming increasingly difficult to get your nutrition in, it's important to speak to a healthcare professional, such as a doctor, dietitian, or midwife. There are a couple of supplements that have been shown to be effective in helping with nausea and morning sickness. The first is a B6 supplement. If this is something that you want to consider, it's important to speak to a healthcare professional about it. Ginger has also been found to be effective, and it has been found that fresh ginger grated right into a drink and eaten right away tends to have better effects than buying a pre-made ginger tea, for example. So that's always a good thing to have on hand when you're not feeling well. Heartburn is another thing that tends to happen when we are first pregnant, so in the first trimester, and definitely can come back with a vengeance in the third trimester. There are some things that you can do to help alleviate the heartburn. One of them is trying to eat smaller meals more frequently. Heartburn is caused by some of the hormonal changes that happen during pregnancy that cause the GI tract to slow down in terms of its motility, and digestion takes longer. Then we have some of the sphincters or openings between different organs in our GI tract that don't close properly, causing the acid reflux. So where possible, eating frequent, smaller meals can help. Also, trying to make sure that you stay elevated for at least 3 hours after eating. And I do understand that this can get tricky when you also are suffering from fatigue. If you do have to lay down, make sure that your throat or your heart is above your stomach. And so what that does is make sure that it keeps your esophagus at a 30-degree incline, which just helps your body be able to use gravity to bring the food into the stomach and keep the acid out of the esophagus. Avoiding things like spicy foods, which can aggravate reflux or indigestion. Avoiding things like chocolate or peppermint. These things can actually relax the sphincter between the stomach and the esophagus, again allowing acid to leave the stomach going up into the esophagus. Constipation is another condition that happens during pregnancy. Again, this is due to some of the hormonal changes that cause our GI tract to slow down. This is actually a good thing because it allows our body more time to access the nutrition that's in food and more time for our body to absorb these nutrients. But of course, it does lead to some uncomfortable side effects, such as reflux, and in this case, constipation. Another cause of constipation in pregnancy sometimes can be our prenatal. It could be due to the type of iron that's in our prenatal, so that also might be something that you want to play with. Perhaps it's buying a different brand or a different type of iron supplement and seeing if that helps. If you do have constipation, there's a few things that you can do to try to alleviate it. First and foremost is just making sure that you're getting enough fiber in your day. So making sure that you're eating enough fruits and vegetables, making sure that you're eating whole grain breads and pastas, making sure that you're eating nuts and seeds. All of these things can help move things through the GI tract a bit quicker. Also making sure that we're getting enough hydration. Often my pregnant clients tell me that that's the first thing that they notice is that their thirst increases when they're pregnant, and there's a good reason for it. Your blood volume starts to increase right away. It also means that you need to drink a lot more water when you're pregnant. So at least 3 liters a day of total fluid is recommended, but sometimes it's up to 4 liters per day that would be ideal. Exercise, even gentle walking if you don't feel up to higher intensity activity, can help keep things moving through your GI tract. Sometimes women find eating prunes helpful, and so it's recommended to eat up to 5 prunes a day. Interestingly, prunes are also very good in terms of bone health, so it can help you maintain your bone density while you're pregnant. There may be a use for magnesium supplements to help with constipation. In particular, doing 200 to 300 milligrams of magnesium citrate can actually help decrease constipation, and these are completely safe to have during pregnancy. Another condition that's quite common to pregnancy is high blood pressure. It is normal for blood pressure to increase as blood volume increases and as pregnancy progresses, but of course, if it increases too high, there are conditions such as preeclampsia that can result. If blood pressure does get too high, it decreases blood volume to the fetus, which means that the fetus is getting less oxygen, it's getting less nutrients, it can lead to growth retardation. So it is important to keep an eye on, and it will be one of the things that your healthcare professional will check at a lot of your pregnancy check-in visits. If your blood pressure does start to get too high, one of the first things that you want to do is look at the sodium intake in your diet. A lot of us don't realize that 80% of our sodium intake doesn't actually come from salt that we add to the food. It comes from sodium that's added to different packaged foods. So for example, condiments are really high in sodium often. Other things such as canned fruit or vegetables or beans or canned sauces are also really high in sodium. Sodium can also be found in high levels in things like bread or cheese or cereal. And so all of these things would be things to look at if you do have high blood pressure and are wanting to limit sodium. If you do have high blood pressure, it would be recommended to try to bring your sodium levels closer to 1,500 to 2,000 milligrams per day. At the same time, potassium can help offset some of the negative impacts of sodium. So while trying to limit sodium, also trying to increase potassium can relax the blood vessel wall and help lower blood pressure. Potassium is found in high degrees in fruits and vegetables, so really underscores the recommendation to have fruits and vegetables multiple times per day, most days of your pregnancy. In particular, things such as potato and banana are really, really high in potassium. The other thing that can help is monitoring hydration to make sure that you are getting enough hydration every day. Doing a little bit of gentle exercise can help lower the blood pressure, and making sure that weight gain is within appropriate targets. These are all ways that you can make sure your blood pressure is staying in a healthy range during pregnancy. High blood sugar or gestational diabetes is another thing that can occur, especially later in pregnancy. It is standard practice for women to be screened for this, and so around 20 weeks of pregnancy, you will go in and get a glucose tolerance test where you will drink a high sugar liquid, and they will test to make sure that your insulin and blood sugar levels are all functioning well. One of the ways of preventing gestational diabetes is trying to make sure that weight gain stays within the 25 to 35 pound range, or whatever was recommended by your doctor. In addition, making sure that when we are eating carbohydrate, it's coming from complex sources, so things such as whole grains, things such as nuts and seeds, beans, fruits and vegetables are all really good ways of getting your carbohydrate intake. Making sure, in addition, that anytime you're eating carbohydrate, you're pairing it with some good protein, fiber, and fat. So, for example, making sure at meals with your carbohydrate, you're having some good protein and vegetables. Making sure that if a snack is something like a piece of toast, that you're pairing it with something like peanut butter to add some protein and fiber to it. So, never eating carbohydrates alone. There is also some evidence that certain probiotics may help with glucose tolerance. So, for example, Lactobacillus species of bacteria may help your body produce enough insulin and function well enough to keep your blood sugar levels in healthy ranges. So that concludes the section on nutrition conditions and interventions, so conditions that commonly happen during pregnancy and how we can use nutrition to either prevent or treat those conditions.